Hello, my name's Harland Holman. I am the lead clerkship director for Michigan State University College of Family Medicine, and I'm excited to talk to you today about the four C's plus two of my own of family medicine. I love to teach our students, and one of the things our students have the opportunity to do is reflect on their experience in family medicine. And we ask them to think about patients that actually elaborate more on these four C's. And I'll just briefly go over them with you and tell you why I love these principles so much. So, the first principle in family medicine is the first contact. So, often when patients have any questions about their health, we're there to answer them. If we can't give them an answer, we try and find out how to give them an answer. But we're kind of the go-to for your health, no matter what it is, no matter what family member, from cradle to grave, from the skin to the head to the toe. So we're the first contact. And kind of going along with that, the second C is comprehensive care. We think about what are the problems that the patient that we see might have right now, and we also comprehensively think about fitting that together with their healthcare overall and using shared decision making to decide what's the best treatment for our patients. Another kind of what I've heard people say, the third C is the secret sauce to family medicine, and that's continuity of care. We see patients over time in multiple settings before they get sick, after they get sick, in recovery. Many family physicians still do hospital care and deliveries, procedures. So we see patients all throughout their lifespan and often see their family members, and we have that continuity. So we don't have to do a deep dive in the chart because we know our patients and they know us and can build that trust. The fourth C for family medicine is coordination of care. We try to handle as much problems as we can, but often there's situations where we will refer our patients. If they have cancer, they may need to see an oncologist, but we're still there for them and we help coordinate that care to make sure they get a good experience no matter who they're seeing in the healthcare field. We know that the system can be hard to manage, and in family medicine, we're there to help you manage it. Um, the other thing I think students often don't realize until they get into our offices is how complex. That's the fifth C that I'm terming today that might not be in the textbooks, but the complex patients, we manage them. Sometimes there's a misperception that we just see coughs and colds and checkups, but we have many patients with complex diseases, including heart disease, kidney disease. Diabetes often is our bread and butter, but it can be complex to manage, along with mental health. There's a shortage of mental health providers, and often in family medicine, we're helping our patients with their complex mental health disorders that they can't see with the mental health provider shortage. And then finally, I think a good family physician needs to show compassion and caring. And I always like the phrase I learned when I was at MSU is your patients don't care how much you know till they know how much you care. So with those, I'm excited to promote our field and looking forward to working with our students this year. Thank you.